Hi, I'm Putterman. I am Chief of the Division of Rheumatology at the Albert Einstein College of Medicine. I'm also Professor of Medicine and of Microbiology and Immunology. The VISE 2.0 test is helpful in multiple clinical scenarios. We use it to help in the diagnosis of symptomatic patients, to help in the diagnosis and differential diagnosis between lupus and other connective tissue disease. The VISE 2.0 can replace general reference laboratory tests. It can help in the diagnosis of patients which have been resistant to serologic diagnosis up until this time, and finally to confirm the diagnosis before embarking on a new type of therapy. So this was a 27-year-old African-American woman who was referred because of a positive ANA and a history of widespread myalgia and arthralgia. So over the last 6 months, this lady has complained of photosensitivity, headache, fatigue, myalgia, joint pain, and morning stiffness, together with a general lack of well-being. It looked to me like an overlap diagnosis between RA and lupus. The VISE 2.0 diagnostic returned a value of 0.9, which is suggestive of lupus. Specifically, the tests were positive for ANA, the MCV was positive, rheumatoid factor was positive, IgM and IgA, and anti-SSA or anti-Rho. In addition, EC4D and BC4D were positive by flow cytometry. I thought that a combination of lupus together with rheumatoid arthritis would be a likely possibility to pursue. So before we embarked on treatment, I wanted to confirm the diagnosis. We also sent her for an X-ray of her hands, which showed erosion, small erosions in her carpal bones. This was supportive and consistent with our clinical diagnosis that we made based upon the patient presentation, the VISE, and the clinical history. I started the patient on a low dose of prednisone, 10 milligrams per day, methotrexate, 10 milligram per week. I do expect her to have a good response, good initial response to prednisone, but because she has an RA and lupus overlap, we will be looking closely at progression of her joint disease. And because of the diagnosis of lupus, we also are going to be considering and monitoring for involvement of other organs that can be involved in lupus, and specifically the kidneys.